As you just saw, Multnomah County has stepped up in so many ways to help our residents navigate immense and cascading challenges. But as we stand at the edge of a post-pandemic world, we have the opportunity to reflect and to ask ourselves, who can and should we become as a community after a year like this? And what does it look like to move forward? Because what the events of the previous year exposed to all of us, beyond a shadow of a doubt, is that the normal we had been living in was marred by inequities and injustices. So for all the wishful thinking about going back to normal, we can't go back to what was. To merely rebuild what was would be to deny the unforgettable sights, sounds, and lessons we've gathered in this past year. Instead, we have to use these experiences to imagine bigger, to propel us to build something better, to capture the sense of and our duty to the possible and not to the past. Our recovery from the pandemic and the years that follow must move Multnomah County toward a new place of strength, health, and hope. As the COVID-19 crisis proved, stable, safe housing is imperative to people's physical, emotional, and mental well-being. Without it, surviving outside is grueling, it's dangerous, and it's just that, a matter of survival. On any given night, 12,000 people in our community are able to lock a door behind them and go to sleep under a roof, in their own bed, because of our homelessness response system that combines housing with supportive services. 12,000 people who would otherwise be homeless if it weren't for that housing. But one look at the tents lining many of our streets tells us that this is simply not enough. However, the way our community responds to homelessness is at the doorstep of transformation. Last May, voters approved an historic investment in supportive housing services that will allow us to meet the challenges of homelessness for decades to come. This infusion of funds will drastically expand our response system, which gives people keys to a home and, just as critically, connects them to the supports they need to stay in that home. The county's new Behavioral Health Resource Center will bring life-saving supports to people experiencing chronic homelessness in the downtown core. Once open, it will offer a day center, a safe 24-hour shelter, behavioral health treatment, and transitional housing. We are on our way toward becoming a community that is fully prepared and able to support every neighbor experiencing chronic homelessness. And I'm also finding great hope today in how community members are engaging personally with the challenge of homelessness, not only with their dollars and donations, but in their willingness to see that our community's future is wound tightly together with that of our neighbors who are surviving on the margins. A business owner recently shared with me that she sees her own success as tied to the stability and health of the individuals who sleep in the doorway of her shop. She didn't say that success depended on removing them from her neighborhood, but in their stability and their health. Community members like her are rejecting punitive and superficial approaches that only address the visibility of homelessness in favor of solutions that help our neighbors escape it. Changing lives requires compassion, consistency, and traveling alongside someone as they get connected to the services they need. That's what Multnomah County does, and that's what we will continue to do as we transform and strengthen the ways in which we serve those who are hurting the most. For decades, Multnomah County's public health has quietly, reliably, and effectively prevented disease and deaths in our community. But what's often gone unnoticed is all the work surrounding disease prevention, health education, outreach, harm reduction, and so much more. Well, that is until this past year, when the pandemic threw a spotlight onto the breadth and depth of public health responsibilities. And to be honest, it's taken the past year for me to gain a better understanding of public health's reach. And I continue to be impressed and grateful for the wide-ranging work they are doing to keep our community safer and healthier, whether we recognize it or not. As community members begin to wrestle with the lasting residual trauma of this once-in-a-lifetime emergency, the work of public health will be critical to keeping people from plunging through the social fabric that has been frayed beyond our imagination. Through the work that they've done for years and the ways they've risen to the challenges of the pandemic, we have seen the transformative potential of a robust and ambitious system that creates healthier conditions for all residents and strengthens historically overlooked communities. That is the vision the county is committed to pursuing as we move forward, where every dollar that we invest in our programs and people returns as a healthier and safer county. Because health isn't just about keeping the community safe from viruses and treating wounds. As we've seen over and over again this past year, our community's health depends on addressing all the inequities that put people's health and lives at risk. So as we look forward, that means Multnomah County Public Health will be a crucial pillar in the work of confronting the community's biggest challenges, like housing instability, climate change, gun violence, and racism itself. All of these major challenges are direct legacies of systems that weren't designed to serve or benefit people of color. Multnomah County is creating pathways to build something better. But better is only possible when we build in a way that intentionally centers and partners with the communities who have historically borne the brunt of inequities and injustice. And at the same time, communities of color do not need the county to tell them what's wrong or how harms can be repaired. They already hold deep wells of wisdom and creativity, brilliance and energy that, when combined with the county's resources, can translate our shared visions for equity, inclusion, and justice into reality. We've taken this approach as we crafted the plan, directing how the county should invest our supportive housing services funding, as we designed the Behavioral Health Resource Center service model, and as we built a COVID-19 response that prioritizes the needs of communities disproportionately impacted by the virus. This spirit of co-creation is essential to bringing equity to life, creating material change in the lives of those who have been harmed by systems built to oppress, to minimize, and to silence. It requires a more inclusive, intentional process, but at Multnomah County, we are as committed to doing things the right way as we are to doing the right thing. Equity and urgency are two sides of the same coin. For example, the voter-approved Preschool for All measure gives us the opportunity to build for the first time an early childhood education system that is created in partnership with families and communities who have been priced out and left out. With their leadership and partnership, we are building a new way of caring for and educating preschoolers where access and racial justice are foundational values. Meanwhile, we are using our Transforming Justice initiative to envision and implement a new model of public safety that is decoupled from the history of institutionalized racism that the criminal legal system is founded on. But we're not doing it alone because we can't. In this process, we're elevating the voices of community members who have experienced firsthand the brutality and the harms of a system explicitly designed to oppress people of color. And together, we're poised to build a new model that promotes healing, stability, and true community safety. Multnomah County is also building equity through our budget, which reveals what we value and aligns our community to the future we wish to build. But our values can't just live on paper. What we invest in must meaningfully improve the lives of our community members. For about a decade, the county has used our equity and empowerment lens to help us design our programs in a way that better connects our values to the real-world differences we seek to make. And now we're applying that lens to our budgets so that every part of our organization, from transportation and IT to human services and health, plan, use, and measure the effect of their limited resources in a way that improves the lives of those we serve. We will use every tool we have to ensure that our work always pushes us closer to a future Multnomah County where we lift up every community member. Every challenge of the last year has been met by the dedication, ingenuity, and adaptability of Multnomah County's 6,000 employees. I am profoundly grateful to all of you. But I'm also aware that our staff can only show up as their best for the community, to embody equity, justice, and inclusion when they experience those values in their own workplace. So I'm committed to ensuring that the county's workforce equity strategic plan remains fully supported as we take steady steps towards becoming an organization that practices our values inside and out. I know that we are all eager to leave behind the events of the last year. But at Multnomah County, we're using the lessons of this unique moment in our community story to build the just and equitable community that I know we can be. And I hope you'll join us as we build it together. Finally, one of the things I am the most grateful for is to lead a board that brings such a diversity of professional experience, expertise, and passion forward on the behalf of the people of Multnomah County. So today, for the first time in the history of this speech, I've asked each of my colleagues, Commissioners Sharon Myron, Sushila Jayapal, Jessica Vega-Peterson, and Lori Stegman, to reflect on their priorities.